If you're a woman over 40 like me, or you know a woman over 40, or you're about to become a woman over 40, then this video is for you. Keep on watching. Assalamu and hello everyone. Welcome to the channel, or welcome back to the channel. My name is Khadija. I am a licensed pharmacist here in the United States. On my channel, I talk about all things women's health and wellness related, with an emphasis on women who are in the perimenopausal, menopausal, and postmenopausal stages of their lives. I also dabble a few videos here and there into lifestyle. So if you are interested in those videos, or you want to see the previous videos that I posted, please check out my playlist and my video history list just to get an idea of what my channel is about. And please, if you enjoy them, like, comment, and subscribe. Also, I am working on live streams. I have a few posted, so please take a look at the live streams and let me know what you think about the topics that I have brought to you so far. Now let's dive into today's topic. So in today's video, I'm going to talk about three main concerns that we as women who are over 40 or who have reached the perimenopausal stage of life should be focusing on. And that includes squatting, building strength and stability, stretching, enhancing flexibility and reducing stress, and sleeping, which is the foundation of health and wellness. So let's first talk about squatting and why it is important for you who are watching out there, or for people you might know. Aging leads to a decline in muscle mass, which is called sarcopenia, or osteoporosis, which is a loss of bone density. And this is very common in women, especially once they reach the age of 50. Nearly 1 in 2 women will experience osteoporosis by the time they reach 50. So anything you can do to mitigate that, or to help prepare your body and improve your bone density, is really going to be important. And squatting, believe it or not, will help with that. So squatting strengthens major muscles, improving mobility, balance, and functional fitness. Squatting overall helps to preserve the bone density, which is necessary to reduce your risk of fracture. This is really necessary, especially when women enter the menopausal transition, which starts around 40, but then when you hit menopause, which is the 12 months without a menstrual cycle, usually around the ages of 50 to 52 years old, it's going to be really important for you to pay attention and to know how to move your body as you're getting older. Squatting also promotes joint health by improving hip, knee, and ankle flexibility. It also reduces stiffness and arthritis risk. So always keeping your joints fluid and moving is going to be very important and key for you as time goes on. And again, joint health is essential for women after the age of 40 to stay active and independent, which is, I know for some of you, it's a crucial thing for you to remain independent. Daily squatting boosts digestion, which is very important as well, by enhancing blood flow and massaging the abdomen. Squats also improve gut mobility. It helps to reduce bloating and strengthens the core and pelvic floor muscles. Now, you don't have to squat with a barbell or dumbbells or anything of that nature, but you can start by using your own body weight and see how you feel. For some of you, it's going to be a little bit difficult at the beginning, but if you do it on a day-to-day basis, especially if you are someone who sits down for multiple hours in the day, maybe you have a desk job, maybe you have a sedentary lifestyle and you need to get moving more, it's going to be really important to try to get up, move, squat. There's a lot of research out there that talks about the benefits of squatting. I will link those articles below, or I will provide a link to those research articles below. But always remember to start slow, start with your body weight, and take it one step at a time. Next, I'd like to talk about stretching. Stretching helps maintain and improve flexibility, especially as we as women age, as everyone ages, to be sincere with you. Tight muscles can lead to poor posture and a high risk of injury. So again, if you're sitting at a desk and you're immobile for most of the day and you're not moving enough, you'll find your body to be a little bit stiff. And that's why it's going to be important to incorporate stretching into your daily routine. Regular stretching of the hip flexors, hamstrings, lower backs, alleviates tension and helps with better posture. You'll also notice that by stretching your torso, your shoulders, your chest, your arms, it's really going to help with you with breathing, with reduced risk of back pain. I know a lot of you might be feeling a lot of tension and tightness in your back. and it helps to support your overall physical well-being. I had invested a few dollars in a foam roller, and that's something I would advise you to look into. The foam roller has really helped me to loosen up a few knots because I haven't been to a chiropractor and I've yet to go to a physical therapist. These are things that I'm considering, at least a physical therapist before the chiropractor. But in the meantime, one of the things I've been doing is trying to foam roll a little bit more to alleviate some of that tension. And again, it took a while for me to get used to the foam roller because at first I was in a lot of pain using it, but over time it's become a little bit more easy to use, and I try to incorporate that into my daily routine. During perimenopause and menopause, we have a lot of fluctuating hormones in our bodies as women, and so it's going to be key for us to reduce that stress, and stretching does help reduce stress. It helps reduce the cortisol levels. It helps us prepare to relax and perhaps get ready for bed. So maybe you need to incorporate stretching and foam rolling right before you go to sleep. Some people, it also helps provide a little bit of mental clarity in addition to that relaxation. And that leads us to our third topic, or something that's really important for us to consider as women as we age, and that's sleep. Sleep is so crucial for our health and wellness. It can be considered the foundation of everything, to be sincere with you. Sleep is important because during sleep, our body rejuvenates, cells rejuvenate themselves. We recover essentially from the wear and tear that our body has been going through during the day, or it depends really on when you're going to get your sleep. But sleep is essential for cell recovery, regeneration, rejuvenation. And for menopausal women who have a fluctuation in their estrogen and progesterone over time, it's really going to be important for us to get into a habit of sleeping well, because a lot of women at night who are perimenopausal, menopausal, do experience night sweats and hot flashes and a disruption of sleep. You may have heard women trying magnesium to help them sleep, or progesterone, given a prescription for progesterone to help alleviate sleep disturbances. And these are things that I can talk about also in a later video. But just understand that, again, adequate sleep helps to maintain cortisol levels, supports insulin balance, which is, of course, necessary for regulating blood sugar and reducing the risk of diabetes. Quality sleep also regulates our hunger hormones, leptin and ghrelin, which are going to be really crucial for us as we're aging, because weight gain and belly fat are all certain things that are high on the list of symptoms that perimenopausal women experience. So the better we get into a sleep habit, the better we are able to control our eating habits. Hopefully we'll be able to manage some of these things that are seen in 85% of the population of women who do go through perimenopause, menopause. In addition to the body recovering and rejuvenating itself, understand that sleep is also important for cognitive function and the ability to think clearly, the ability to be strategic in what you're doing. Because when you're not sleeping well, and this is in research, it takes about 1 to 2 days or more, depending, to recover if you've had one night of bad sleep. So understand that it's not like you can the next day just recover from that poor sleep. It actually takes a while for you to catch up and get into a better habit, and for your body to feel adjusted or recalibrated from that night of disrupted sleep. And understand that poor sleep can weaken your immunity, it can incite inflammatory markers, it can do a lot of things that might make you susceptible to illness and infection. So put away your phone an hour or two before you sleep. Don't eat too close to bedtime. Make sure you're in a comfortable environment where you can get good uninterrupted sleep, and just consider different things that might help you with your sleep hygiene. And this is going to help you along the way, of course, with trying to manage everything that I'm talking about. And please do consider taking things one step at a time and investigating what works best for you. And remember, always do your research. Contact your healthcare provider or a healthcare provider if you don't have one, to talk to them about any issues you might be experiencing. Also, always consider what you might be going through. Do you have any underlying illnesses that you need to address first? Please always consider that before starting a new routine or a new medication or a new product. Seek your healthcare provider's opinion and then address any underlying issues you might be having at that very moment. Please always remember it's not too late to take care of yourself. Now might be the time where you need to get into your good habits, your good healthy habits, and keep them on for the rest of your life for health, wellness, and longevity. Also know that, remember, when I talk about squatting, when I talk about stretching, when I talk about sleep, these are all things that are scientifically proven to help you along the way, especially as you age. Again, I will leave the link to all of the research below. I will encourage you again to do your own research and to look into these things and to see what might be of benefit to you. I wish you all joy, happiness, and health. I hope this video has been beneficial for you. Let me know in the comments, and I will see you in the next video. Thank you for watching. Bye.